Hello, hello. This is going to be chapter 14 from your Psilocybin Mushroom Companion, and this is a very important chapter. This one is the potential risks of psilocybin. Now, this one dives, it's a pretty long chapter and it's broken down into different sections of people that should not be taking psilocybin and possible drug interactions. And so I think I'm going to make a separate video for each one, just so it's easy to find, because I'm not some like wizard um, video editor. So I'm still getting used to doing this. So bear with me. But we'll read a little bit and then get into yeah, different reasons why certain people shouldn't be taking psilocybin. So there's a lot of talk about how psychedelics aren't for everyone, that maybe some people should avoid mind revealing substances like psilocybin due to pre existing mental or physical health conditions. It's a controversial topic in the psychedelic community, with anecdotes proving both sides of the story. At first, I thought to call this chapter Who Should Avoid Psychedelics, but changed the wording because it's not exactly true. When I asked experts about the conditions we're going to look into this chapter, most told me there could be instances of these people using psilocybin just under a much more controlled setting than your average naturalistic mushroom trip. So while this chapter is meant to give you information to make an informed decision, there are no hard or no, there are no hard and fast rules on who should or shouldn't take magic mushrooms. Yet, even Terence McKenna, one of the biggest proponents of taking psychedelics, believes they aren't for everyone. In an interview with Omni magazine in 1993, he responded to the question what people specifically should not take them, like this: people who are mentally unstable, under enormous pressure, or operating equipment that the lives of hundreds of people depend on, or the fragile ones among us, those whom wouldn't give a weekend airline ticket to Paris, those who wouldn't expect to guide you out of the Yukon. Some people have been so damaged by life that boundary dissolution is not helpful to them. These people are trying to maintain boundaries, their functionality. They should be honored and supported and not encouraged to take drugs. If because of genetic or culture or physiological factors it's not for you, then it's not for you. Who is disqualified from participating in clinical trials and why? For whom do psychedelics pose the biggest risk? To answer this question, I looked at what types of conditions disqualify people from participating in clinical trials with psilocybin. At the moment, the main conditions include hypertension and other underlying heart conditions, history of psychosis, or a psychotic spectrum disorder like schizophrenia, bipolar disorder, other persistent severe mental illness, as well as a first degree relative with any of the psychiatric conditions. Also, for the time being, pregnant people are also excluded. However, three active psychedelic researchers I spoke with all expressed a desire to work with most of these populations in the future. Therefore, it's not that people with these conditions Therefore, it's not that people with these conditions absolutely cannot take psychedelics, but the risks are greater, as we're about to explain in the next section. So there will likely be more of a need for trained guides, thorough preparation, and close post meeting monitoring. Rose Watts explains simply that these trials are essentially rushed at the moment and there's not enough time to give these populations the extra support they might require. Peter Hendricks has a different take. If something were to go wrong at these early stages, psilocybin would likely be blamed as the cause for the negative outcome. Essentially, Hendricks believes researchers are taking an abundance of caution in order to ensure psychedelic research can continue without hiccups like they encountered in the 1960s. He explains in his other research on smoking cessation, if his team were doing a large clinical trial with a new nicotine patch, they would sadly anticipate a few fatalities just due to the population. Some might be older, smoking for decades, and their deaths are a potential reality that wouldn't immediately be blamed on the nicotine patch they were testing. But with heightened political lens surrounding psilocybin trials, if anything went wrong, he believes it could potentially threaten the whole future of psychedelic research. All of that being said, if you do have one of the following conditions, please seriously weigh the potential risks and benefits of using psilocybin. And don't go into psychedelic experience without adequate preparation and support for both of the drug experience and the weeks following. So we'll go over the first one, which is hypertension and underlying heart conditions. This one's very important. The main physical condition researchers screen for in clinical trials with psychedelics is hypertension. Erica Zelfand explains that because psilocybin affects serotonin pathways, it can transiently run the risk of elevating blood pressure and altering body temperature. Hendricks elaborates, explaining that psilocybin can modestly increase blood pressure from maybe 20 points. If you have an underlying heart condition like serious arrhythmia, or you have hypertensive, it can create a condition in which the likelihood of a heart event is raised. He said that he wouldn't be surprised that a higher dose of psilocybin could cause a heart attack in someone with a heart condition. But then, so could exercise. So could a number of things, right? He adds that for people, taking psilocybin would at least require physician oversight and monitoring. There also seems to be extra risk for those who have had a past of open heart surgery. One of the only recorded deaths associated with psilocybin ingestion was of a heart transplant patient. This person received a heart transplant 10 years before her psilocybin experience, but it was apparently still too much for her body to handle, and she went into cardiac arrest 2 or 3 hours after consuming mushrooms. I guess we can go on to one more. Psychotic spectrum disorders. The main mental health condition the psychedelic community warns people about is schizophrenia or a family history of psychotic spectrum disorder. It's generally believed that taking a psychedelic when you are genetically predisposed to an experience, psychosis can speed along the time of your first psychotic break, and Henderson confirms this for me in so many words. For this same reason, he says it's especially dangerous for young people with a predisposition to psychosis to take psilocybin. When I ask Watts about this, she points me to a study from a mid 20th century where a participant had a problematic psychotic response to LSD. When it was further investigated, it was found that this person was a twin brother of someone with schizophrenia. And so now these types of first degree relatives are excluded to prevent this from reoccurring. Obviously, more research is needed moving forward. It's not conclusive, says Hendricks. I even think there could be a future in which we examine psilocybin as a treatment for schizophrenia, but it involves, obviously, affective disturbance and depression. And I think there might be a case for that. This one is on epilepsy and the history of seizures. Although not explicitly disqualified from all clinical trials with psychedelics, there is some concern for those with epilepsy or a history of seizures taking psilocybin. Giordano tells me the concern isn't for the trip itself, but for the come down. That's because psilocybin can change the neurochemical balance of someone with epilepsy and can reset their seizure threshold. This risk is increased for those on anti-epilepsy medications because the interaction of the medication with the psilocybin and changing the brain's network activities may be detrimental. I asked him, what if someone has only had one seizure in the past? Should they still avoid psilocybin? He replies that if it was years ago, there's no subsequent seizure activity, and that person wasn't taking seizure medication, then maybe a mushroom trip could be a possibility. But he also warns that if the person has a substance-induced seizure, then they should avoid psychedelics because there is a risk of substance induction, which is a type of substance-induced psychosis. Giordano ends our conversation about epilepsy, pointing out that there that there's a caveat, that there's a caveat, I don't know what that means, that perhaps people with epilepsy or a history of seizures could still use psilocybin, just not without a clinical trial. Possible drug interactions. Like I described in Chapter 1, psilocybin is a relatively safe compound, especially when used mindfully with adequate preparation, but problems can arise once you start mixing psilocybin with other substances, including prescription supplements, other ceremonial plants, and recreational drugs. The following list of possible drug interactions is just a starting point, highlighting frequently asked about drug mixes. It is by no means an official reference, especially if you're considering taking psilocybin while on prescription medication. I urge you to continue doing your research and speak with a physician before mixing any types of substances. And when it comes to recreational mixes, remember that psilocybin is very powerful and sacred, and the safest way to use it is on its own in a secure and prepared environment. Once you start adding things into the soup, so to speak, the flavor has a potential to change. Giordano says to highlight this fact, and you simply can't guarantee what that's going to be like. Antidepressants, SSRIs, and SNRIs. The main prescription mix the experts warn against is combining psilocybin and antidepressants like SSRIs and serotonin, neuropirephrine rebuke inhibitors. Some popular brands include Prozac, Zoloft, Paxil, Lexapro, Cymbalta, and Effixor. That's because these drugs also affect the serotonin system, the main receptor system that psilocybin interacts with. Giordano explains that these types of antidepressants already make more serotonin available to the space between the nerve cells in the brain. And so when psilocybin also acts on this system, there's risk of essentially overdosing on serotonin, known as serotonin syndrome. Giordano says symptoms could include sweating, agitation, elevation in body temperature, sleeplessness, cardiac effect, and a very peculiar motor activity called wet dog shakes. But when I ask other experts about the risks of serotonin syndrome, they explain it's very rare to occur from combining only psilocybin and antidepressants. Zeflin said she'd be more worried if someone was mixing multiple drugs, for example, combining psilocybin with an antidepressant and another psychedelic like DMT, and a pathogen like MDMA or the popular supplement FHTP would pose a much higher risk. Zeflin reiterates something I've heard in the community and through my interviews with mushroom users, that people who take psilocybin while on SSRI or SNRI antidepressants simply just feel less of the psychedelic effect and have to take more shrooms than their friends to trip it all. So I just want to reiterate that this is based on clinical trials where people go in and take heavier doses of mushrooms for therapy purposes and for study purposes. This is not really based on microdosing, but of course, microdosing and the psilocybin can still affect people that are on these medications or have these health disorders. So like the book said, always do your research. You can ask questions, talk to your doctor before getting on mushrooms. It's just the best way to go about it, just for your safety, because we would hate to see anything bad to happen to anybody. Yeah. So, bottom line, I would definitely approach this mix with caution. It's also important to keep in mind that stopping your antidepressants to take psilocybin comes with its own risks, especially withdrawal, depression, and suicidal ideation. Plus, most antidepressants have a very long half-life, meaning you can't stop taking them the day of your planned mushroom trip. To get an SSRI completely out of your system, it's best to wait at least 2 weeks since your last dose before taking psilocybin, and always consult your doctor when weaning off prescription medication. Wellbutrin. The last thing worth mentioning about antidepressants is not all of them affect the brain's serotonin system. For example, bupropion, which is the main ingredient of the popular antidepressant Wellbutrin, works by affecting the brain's dopamine system and so poses less of a risk when mixing with psilocybin, says both Giordano and Zeflin. What's more, Wellbutrin shouldn't dull the effects of your trip like the SSRI or the SNRI. Antidepressants likely will. Mood stabilizers. Through talking to people, I found that mood stabilizers are another common prescription for those struggling with depression, anxiety, and related mood disorders in the United States. The same precaution goes for mood stabilizers as antidepressants. Mixing them isn't the best idea, but the risk increases if the medication interacts with the serotonin system or if you mix multiple drugs. I asked doctors about any potential risk of mixing psilocybin with two popular mood stabilizers, lamictal and lithium, and learned something interesting about each. While both Giordano and Zeflin don't note any significant risks of combining mushrooms with lamictal, Giordano expresses concern with lithium. First, he explains lithium has a downstream effect on the serotonin system, and so it's one of the drug interactions that could increase your chance of serotonin syndrome. What's more, mixing the two can also change the way they're each metabolized. Because lithium exists in a very narrow therapeutic window that can lead to negative consequences, including lithium toxicity, which can be dangerous. Giordano also warns of the possibility for a really heavy come down in which people can become profoundly depressed. Overall, he suggested is not to mix psilocybin with lithium to avoid a potential problematic reaction. Benzodiazepines. Benzos like Xanax, Klonopin, and Ativan are generally used to relieve acute anxiety and can also do so during a distressing psychedelic experience, but with a few caveats. First of all, medication should only be administered by a clinician, so I can't recommend you taking one or offer one to another person to relieve a bad trip. That being said, it is pretty common knowledge within the psychedelic community that benzos can help people calm down from really scary and a stress-induced journey. Zeflin confirms this for me, explaining they can act as a kind of a ripcord from psychedelic experiences. You'll still be tripping, she says, but you won't be as distressed by it because of the calming effects of the benzodiazepine. Cannabis. Mixing psilocybin and cannabis is probably the most popular drug combination. Psychologically, it's pretty safe unless you have an underlying heart condition. Then there's a chance it could be dangerous. But psychologically, the subjective experience of mixing the two substances can be very strong. For me, it's smoking THC cannabis while I'm already under influence of mushrooms really accentuates the psilocybin and can make the psychedelic effect feel much stronger, especially towards the end of the psilocybin trip when the psychedelic effects are beginning to wear off. Smoking a little cannabis can bring me right back to full-on tripping, but I'm a regular cannabis consumer who is comfortable with the mushroom experience, so it's not overwhelming. If you're inexperienced with both substances, I would say hold off on combining the two because it can be pretty intense, especially if you're the type of person for whom using high THC cannabis makes you anxious. The anxiety-induced effect will likely be strengthened while also under the influence of psilocybin. Giordano confirms this, explaining that it all comes back to context. If cannabis makes you anxious generally, using it while tripping can change your whole mood state or set to one of anxiety, which can then flavor your trip for the worse. Alcohol. None of the experts I spoke with expressed much concern over mixing alcohol with magic mushrooms, especially in low doses, 1 or 2 drinks. I can say from experience that you probably wouldn't crave much alcohol while you're actively tripping because the thought of consuming much of anything is often pretty secondary. Some have said that a drink before a psychedelic experience helps them unwind, but I would also caution it could increase the chance of nausea and vomiting. I also wouldn't recommend accepting any mushrooms while you're already in a social situation. It's a common first trip mistake to take them casually and drunkenly at a party setting without any preparation or care taken as to the set and setting, which can end in folks having a really overwhelming experience. I personally like a single cold beer after a psychedelic experience, but I also like cold beer after work in general, and often tripping is tiring in a similar way. Plus, it can help me unwind and fall asleep which can be hard after tripping for several hours. MDMA. Taking MDMA or ecstasy with psilocybin, or LSD for that matter, is a popular recreational mix known as hippie flipping. But even though people do it, and there's a fun nickname for it, it doesn't mean it's completely safe. Giordano expresses a lot of concern when I asked him about the mix. That combination can cause a rather dramatic depletion of serotonin, and the crash effect can be profound, he said. What's more, the risk is increased if you take multiple doses of MDMA throughout the night. Then you run the risk of a clinical come down known as serotonin rebound syndrome. Although it's a popular mix because of the way it makes individuals feel acutely, you're really juggling chainsaws with that one. DMT booster doses and other psychedelics. Sometimes I hear people mixing psychedelics. It's commonly either taking a hit of smokable DMT while they're already on psilocybin, or taking a booster dose of the same substance a few hours into the experience. While booster doses of psilocybin are basically safe, they're usually not necessary. My biggest concern is that people don't wait long enough for the first dose to fully kick in and end up taking more mushrooms than they're prepared for. Well, that was my first time. Let me tell you, that was a wild ride. If you're set on making a booster dose available, I would say wait a full 90 minutes or to 2 hours to evaluate how you feel before adding any more medicine to your system. As far as combining psychedelics, Giordano does not recommend it. Although he admits that mixing LSD and psilocybin would be safer than combining mushrooms with DMT, especially ayahuasca, but also smokable forms of DMT. That's because DMT not only stimulates an increase in the release of serotonin, but it also stimulates tryptamine. I knew that word. It's on the tip of my tongue. It stimulates tryptamine, which then also binds to serotonin. You're getting the big whammy there, Giordano warns. And so it's probably best for your brain and your come down to avoid the mix and experience each substance individual. Okay, so next is GHB and ketamine. We're not going to get into that. Let's see. And that just talks about how, like, what's a healthy, like, how often to trip. We're really not here to talk about tripping. We're here to talk about microdosing. I think what we'll get into next, and I think is really important, is integration. Now, like I said, this book is really based on, like, clinical trials of taking macrodoses. But still, integrating your experience, why microdosing is still really important. So I think we will go over that next. I think I will do that tomorrow, or maybe I'll have some time today to do it. But yeah, integration is very important because what you're feeling in the moment and the things you experience in the moment and the realizations you have in the moment, unless you take them into your everyday life and really have an open mind, like journal how you're feeling and really be aware throughout your days after you microdose on how you're feeling, that's how it's going to change your life. So when you microdose, your brain, like I said in my video when I was at the beach, if you haven't watched it, like when you see a problem, like usually you see a problem one way and you're used to dealing with it one way. When you microdose, it like opens up this network in your brain that's never been used before, like these new neural pathways of thinking and resolving and dealing and coping. They're all opened up and it's all new. And so you see things as a whole. That's really cool. So you don't just react. You sit with it, you think, and yeah, it's pretty amazing. So yeah, the next one we'll do is integration. So I hope you guys enjoyed that. Moral of the story is, if you're taking medications, talk to your doctor, period, and make sure that it's okay that you're taking psilocybin. Again, we're just talking about microdosing. We're not talking about having trips or anything. Yeah, so I hope you guys have a wonderful evening. Bye bye.